The objective of this project is to acknowledge the roles of artificial intelligence during COVID-19 and what the world do to prevent these pandemic diseases from spreading continuously. "2020 is really an unfortunate year when we had to stay in our home for months and weren't allowed to go out doing our daily activities. This is due to the pandemic disease that's easily spread through the air, and it's even scarier when the disease can take a person's life. So, this is the opportunity of the technology's developer to create a new technology that applies AI which can be used to help in recovering this pandemic disease." So, what does AI do in order to counter this pandemic disease? The first one is health tracking device. In this modern era, technologies and internet are everything. With the abilities of the technology, AI had created a device named Emerald. The co-founder of this device is Dina Katabi, a professor at MIT. According to her, the device is shaped like a Wi-Fi router and sits in the background at your home. The main function of this device are to track breathing, heartbeat, and sleep pattern through the environment by using artificial intelligence. What is good about this device is it doesn't need any wire to connect on human's body, so it is easy to track the patient's health index from time to time. This can ensure the caregiver can do their job as safe as they can. Apart from that, even without any physical contact with the patient, they still can acknowledge their health index. This can reduce the risk of getting the virus, and it is also possible to reduce the spreading of coronavirus. To be short, this device can give a long-term effect which is reducing the amount of COVID-19 cases. As we know, the most vulnerable category of people that can easily get sick are older people and also kids. So, the co-founder of this device, Dina Katabi, had deployed the device to the retirement home in Boston. This is to help the doctor or the caregiver of the COVID-19 patients to easily track their patient's health index even when they are at home. The second one is AI innovation to flatten the curve. During this pandemic season, all information are required in a short period of time. This is to ensure that the carrier of the dangerous virus can be detected as fast as possible to avoid its spreading. China is one of the countries that is really advanced in developing various types of technologies. Thus, to counter the spread of the virus, China had created a smart reading system which is called Ping An Smart Healthcare. It applies AI technologies to examine CT scan images on the same person. Then, it will track the changes from time to time. The system not only can collect data, but also can interpret the data within only few seconds. The third one is AI to help detect, diagnose, and prevent the spread of the coronavirus. AI can also be employed to help detect, diagnose, and prevent the spread of the virus. Algorithms that identify patterns and anomalies are already working to detect and predict the spread of COVID-19, while image recognition systems are speeding up medical diagnosis. AI-powered early warning systems can help detect epidemiological patterns by mining mainstream news, online content, and other information channels in multiple languages to provide early warnings which can complement syndromic surveillance and other healthcare networks and data flows. AI tools can help identify virus transmission chains and monitor broader economic impacts. In several cases, AI technologies have demonstrated their potential to infer epidemiological data more rapidly than traditional reporting of health data. Institutions such as Johns Hopkins University and the OECD have also made available interactive dashboards that track the virus spread through live news and real-time data on confirmed coronavirus cases, recoveries, and deaths. The fourth one is using artificial intelligence to detect, respond, and recover from COVID-19. Before the world was even aware of the threat posed by the coronavirus, AI systems had detected the outbreak of an unknown type of pneumonia in the People's Republic of China. As the outbreak has now become a global pandemic, AI tools and technologies can be employed to support efforts of policymakers, the medical community, and society at large to make every stage of the crisis and its aftermath, detection, prevention, response, recovery, and to accelerate research.
Accelerating research using AI to understand and treat COVID-19. AI tools and techniques can help policymakers and the medical community understand the COVID virus and accelerate research on treatment by rapidly analyzing large volumes of research of data. AI text and data mining tools can uncover the virus history, transmissions, and diagnostics management measure and lessons from previous epidemics. Deep learning models can help predict old and new drugs or treatments that might treat COVID-19. Several institutions are using AI to identify treatments and develop prototype vaccines. DeepMind and several other organizations have used deep learning to predict the structure of proteins associated with SARS-CoV-2, the virus that causes COVID-19. To help facilitate the use of AI throughout the crisis, policymakers should encourage the sharing of medical, molecular, and scientific datasets and models on collaborative platforms to help AI researchers build effective tools for the medical community and should ensure that researchers have access to the necessary computing capacity. To realize the full promise of AI to combat COVID-19, policymakers must ensure the AI systems are trustworthy and aligned the OECD's AI principles. They should respect human rights and privacy, be transparent, explainable, robust, secure and safe, and actors involved in their development and use should remain equitable.